globally. So COVID-19 pandemic has adverse effects on the psychological well-being of people all over the world. So immediately after the first confirmed case of COVID-19 in Ethiopia, March 2020, the government of Ethiopia took several measures which will keep the public from being infected with this deadly virus. So even though there has been a lot of measures were passed by the government, still peoples of Ethiopia were reluctant to adhere to the measures, so that even experts were telling that the overwhelming effect of COVID-19 has impact on the more direct and indirect mortality from preventable and treatable condition will increase. The suggested solution, like physical distancing and stay-home orders, were implemented with appropriate precaution. And even though this has been implemented, people with underlying health problem, like people living with HIV/AIDS, and those with chronic respiratory problems were still vulnerable to such a deadly infection. Uh, Therefore, this study is aimed to explore how a stay-home order during the COVID-19 pandemic impairs engagement along HIV care continuum in public hospitals of Southwest Ethiopia. Uh, to come up with the methodology, the study setting, this study was conducted in 4 public hospitals of Southwest Ethiopia: Jimma University Medical Center, Bonga Hospitals, Mizan Tepe University Teaching Hospitals, and Tepe Hospital from May 22, June 3, 2020. Study approach is a descriptive qualitative study design was employed. So on the data collection procedures or instrument person and data collection, the questionnaire were prepared, or the interview guide was prepared in English, then translated to Amharic and Afan Oromo, then back translated to uh, uh, English to see the consistency in meaning. The data were collected using semi-structured semi-structured interview guide with 10 open-ended questions with a probing lists. So the guide has, a sort of arranging it from general and moving to specific, from the general question to the probing to the specific. And this guide considered the cultural issues and the local knowledge were in place. So the guide is able to cover a topic related to challenge to adhere or to adhere to the appointment of HIV/AIDS care continuum. So a total of 27 in-depth interviews with participants through phone call. Due to the COVID protocol, we have conducted phone calls, and the phone calls were recorded and then proceed with the analysis. So the sampling technique used were purposive sampling, that is non-probability sampling technique was employed. So the participants were recruited from the information that we received from the 4 ART clinics, because of the information that we get delayed their appointment. When you come to the data analysis, in-depth interview with people living HIV/AIDS were transcribed in English, and transcripts were thematically analyzed using Atlas TI software. First reading and rereading of the transcripts were done. This is one of the attributes of qualitative research, to bring to code the data appropriately. Then secondly, the idea quotes were identified with the topics, and the potential categories and themes were emerged. Finally, the results were presented with the major themes and sub-themes or category, and with appropriate quotations. On the validation and trustworthiness issue, this is one of the qualitative research that various methods have been used to ensure the reliability of the analysis. Like credibility will be ensured through peer debriefing, member checking, creating report. Even negative case analysis were done to those unusual findings, to ensure the unusual findings. So these are how we are going to through the rigor of the qualitative research method. When you come to the results, a total of 27 participants were engaged in these in-depth interviews. Among these, males are 17 in number. The majority were married, and age ranged from 21 to 66. On the main themes that has been emerged due to after analysis using Atlas-TI, there are main themes. The first main theme is psychosocial reactions. Due to the pandemic, people have a sort of just thinking of depressions, hopelessness, and fears are the main sub-themes. I mean, the sub-themes that emerged from the main themes. So to support our finding with the quotation that due to the emergence of this pandemic, people living with HIV/AIDS were get depressed and hopeless. So this was one of the quotations that we are extracted from female participant with the age of 75. On the other is term risk perception. So they are just people with HIV are just perceiving the being susceptible to the disease and the severity of encountering a problem due to the have comorbidities, that is HIV/AIDS. Therefore, one of the in-depth interview male participant, which said that COVID-19 is dangerous, how they perceive risks. Because they have HIV in blood, they think that they have a high risk of encountering a problem due to the comorbidities. The third thing from this research is forceful stay orders enforcement, which is subthemed as police beating and community leader disgracing. Whenever, due to the reluctant nature of the people to implement stay-home orders, so police are trying to take measures because of their issue. But this is hindered them to adhere to the recommended, ART medications. So one of the care participants with a male participant with age 27 says that even though he know that the ART medication is running out, he feared to refill because of the police beating and community leaders disgracing, that means insulting on others. On the fourth main theme from this is economic barriers, as one of the presenters said that these sub-themes are transportations, cost, and employment. So due to keep a physical distance, people with HIV/AIDS were obliged to pay double. Therefore, due to this, they try to miss their appointment. Therefore, the employment status due to the lockdown, since the majority of the people are daily breadwinners, they stay at home, so they don't able to go for to access the transport, pay for the transportation, and the money they have had no because of the employment status. And this is just confirmed by the quotation from the male participant with 25 age. The other is on social factors like perception of stigma. So majority of this in Southwest Ethiopia from Jimma University Medical Center, Bonga, Mizon, and Tepi. So they prefer to start the ART from by going something from other zone, from zones they are other than the zone that they are living. Therefore, and due to the stigma issue, they prefer to go others, and that's why if they go with this stay-home order implementation time, they are going to be identified by others, so that they will, due to fear of stigma, they try to following ART follow-up. The other is religious barriers. Religious beliefs. One of the male participant confirmed that HIV has no medication, as well as COVID has no medication. The only thing they are expecting is the divine intervention. Therefore, such a kind of issues hinder them not to refill their ART medications. The sixth theme is misinformation. Related to this are the sub-themes are rumor related to ART supply. Even USA fund cut were the rumors that they hindered them not to adhere to their medication or refill to their medication. And lockdown and no ART supply rumors or misinformation led them not to adhere to the ART medication. So this is confirmed by the female participant from the KI informants. The other is health service factors, inadequate information that they receive, and the distance, focusing the distance from the hospitals, and focus shifts to COVID-19 allows them not to adhere to their medication. So this is also quoted as the female participant where said that because of the information, because of the health professional character, she obliged, or the limited information that she received, she obliged to not to adhere the recommended ratio, the recommended diabetes drug. As discussion, as I have said earlier, these are the main themes that identified psychosocial reactions, risk perceptions, forceful stay-home orders, and this is actually on the psychosocial reaction. This is also in line with different study has been done globally due to this. For instance, in a research done in USA, the people living with HIV are perceiving that they are, and risk perception is also in line with different findings that has been done globally. Forceful stay-home orders. This is we can see different Indian research that police were beating whenever they are going for medical treatment. On the economic barriers, obviously, that is a barrier to the adherence to HIV/AIDS treatment, and social factors where has both, in some researches has both facilitating and challenging issues. And misinformation is also supported by different findings all over the world, or research done all over the world. On the having to conclude this finding, overall, this study found to be the major factors that influence or impairs the adherence to HIV/AIDS treatment during this critical period of COVID-19 were psychosocial, risk perception, forceful stay homes, and the like. So from this finding, we can recommend that healthcare providers should work on providing health information targeting the benefit of ART medication, adherence, and timely reminder of the appointments or phone calls. And structured information, education, communication should be provided for on the risk contracting COVID-19 if people living with HIV/AIDS is not on treatment, and encouraging them to continue follow-up in the hospitals. Therefore, I want to acknowledge these colleagues, participants, the institutions, and the Addis Ababa University, Addis Ababa Medical and Business College for this opportunity. Thank you very much. And some of the references that I have used, and thank you very much.
Thank you so much, round of applause for Abraham. That was very interesting. We can go ahead with the next presentation before having a discussion, right? So you go ahead.
Okay, really, I'm very pleased to be here today to present finding of my research on the most common non-communicable disease, which is being a headache for the world population nowadays, which is diabetes mellitus. And I'm no need of explaining myself. And when you start from the introduction, just DM is globally estimated to affect around 463 million population among these age groups, which corresponds to 9.3 prevalence, and it's estimated to kill around 4.2 million diseases, which corresponds to around 1 day every 8 seconds. When it comes to our continent, Africa, it's affected around 190 million population, which is estimated to, which is projected to increase by 143% in 2045. When it comes to Ethiopia, it is the population which have DM is estimated to be around 1.7 million, which makes one of the top 5 from African population. So one of the severity of DM is due to its association with its complication, among which CKD is one, and it's expected to be around 30% of type 1 and 40% of type 2 diabetes expected to develop CKD throughout their life. And globally, CKD is estimated to be ranging from 8